So today we're going to be talking about practice, policy, and prevention, specifically in regard to adult interpersonal violence. So we're not going to really be focusing on kids today, but we're going to really just focus on adults. So we're going to be talking about some different ways that we can try to improve our current responses to interpersonal violence in adults. So let's first just take a minute and talk about what each of those three things mean. What does practice mean? What does policy mean? And what are we talking about when we talk about prevention? How are those three things different and how do they overlap? So first and foremost, when we're talking about practice, we're talking about different ways that therapists and other sort of professionals that work with people in a counseling setting, what are some different strategies and practices that we use when focusing on adult interpersonal violence treatment? When we're talking about policy, we're really referring to different laws and policy guidelines that are in place right now in regards to intimate partner violence. And then when we talk about prevention, we're really trying to talk about innovative programs to help people that have experienced interpersonal violence avoid future re-victimization, and also to work with people that are perpetrators of abuse and trying to get them to learn some different ways to manage their behavior. So let's talk first about practice. What are some current things that we're doing in practice to help these individuals that have experienced intimate partner violence? So let's first look at agencies that work with individuals that have experienced IPV, and then we'll talk about what practices look like in an individual therapist level. So when we're looking at agencies that deal with people that have experienced IPV, typically we're talking about things like battered women's shelters or other types of transitional housing systems that are specifically geared towards people that have experienced IPV. So the primary concern of these agencies is really to focus on helping individuals that have experienced IPV gain social support and begin their sort of healing process. So there are sort of three different types of social support that these agencies are going to focus on. First and foremost, they really focus on providing victims of IPV with instrumental support. So things like housing, food, toiletries, things that people might not have access to after coming out of a violent relationship. Additionally, often agencies will provide victims of IPV with emotional support by allowing them to attend social support groups or providing them with therapy services. And then finally, often agencies that deal with victims of IPV are going to provide some sort of informational support. So having them attend classes that are specialized in dealing with IPV issues, providing them with psychoeducational information in the group setting about IPV and about services outside in the community that could be helpful for them. So these are some of the ways or some of the current practices that go on in agencies in terms of providing support for individuals that have experienced IPV. Additionally, when we look at agencies that work with primarily women that have experienced IPV, there's been some research looking at what do the individuals that go to these shelters and agencies think is helpful in their treatment of IPV. So what sort of things do the people that seek out these services find helpful about the agencies that they go to? So some of those things people have reported have been helpful have to do with the attitude of the agency. So the people that work at the agency and sort of the overall feeling that they get when they go to the agency, do they display genuine concern about this individual and this individual's experiences? Are they respectful of the client's ideas and choices? Do they acknowledge the client's own strengths and capabilities? And do they validate the client's experiences and feelings? So all of these things have been reported as helpful by people that have utilized different sort of shelters and transitional housing specifically for IPV. Additionally, people have reported that in terms of the services that are provided at IPV shelters, things that are helpful are 24-hour access to services. So, if it's 3 a.m. and there's some sort of crisis, knowing that they could go to that shelter at any time of day was really helpful. Providing all-female support groups and the safety that might provide to somebody that's experienced IPV. And then having at least one or two female service providers within the agency is also helpful for people that have experienced IPV and seeking out these services. Other things that women have reported are helpful that agencies tend to offer: referrals for legal services. So often when you're dealing with someone that's experienced IPV, they might have some legal needs that they have to take care of. And so being able to provide those referrals is really helpful. And then just referring out to other community services like therapy or outside support groups is also something that people have found really helpful. And then also within the agency, offering group activities and in-house group support systems has been reported to be really helpful. But specifically for agencies that do offer those group activities, allowing someone to sort of progress at their own pace from maybe just sort of starting off, observing the group, to sharing their own story about their experience with IPV, to sort of observing and watching other people that have shared their own stories, and then finally, becoming ultimately a role model for other victims of IPV. So having that sort of progression and allowing that progression to take place is something that women have reported is extremely helpful when they attend services at these different agencies. Okay, so let's talk for a minute about what do practices look like from a psychotherapy standpoint. So what are some common practices for individual therapists? So first and foremost, our current practice for psychotherapy is to conduct clinical screenings for interpersonal violence with all of the clients that we see. So no matter if this person is coming in for an anxiety screening or a depression screening or whatever the case may be, clinicians are supposed to be assessing for the possibility of interpersonal violence. Now, that doesn't always happen, and certainly there are times when clinicians don't assess for these things, but it's supposed to be the best practice that all clinicians are doing this screening for interpersonal violence. If a client has reported that they've experienced interpersonal violence, the clinician's job, first and foremost, is to focus on safety. So making sure that this person has a plan for safety, whether that's if this person is still involved in the violent relationship, thinking about ways to keep them safe while they decide whether or not they would like to stay in the relationship. And if this person has come out of the relationship, making sure that there's some sort of plan in place to keep this person safe. So safety is probably the most important piece when you've got someone that's experienced IPV for the clinician to be focusing on. So this might involve not only just thinking about the safety of the client, but if there are children involved, you might also have to safety plan around this individual's children as well. So some other common practices or things that will come up for a therapist working with a client that has experienced interpersonal violence. Often you're going to spend a significant amount of time initially in therapy sort of just talking about different forms of interpersonal violence. So kind of going back to that psychoeducational piece of just talking about different types of abuse and what might cause those different types of abuse. You might also spend some time exploring this person's family history and family background and individual reasons why this person may have experienced interpersonal violence. You're also probably going to spend some time exploring how interpersonal violence has directly affected this person. So how has it affected their mental health? How has it affected their ability to function in life? And if there are children involved, how has it affected their ability to parent? So all of these things are going to be talked about in psychotherapy and made a direct focus as a part of IPV treatment. And probably the most important thing, in addition to focusing on safety, is that the therapist provides some type of emotional support and validation for this person's experience. So throughout the entirety of therapy, the therapist's goal is really just to make sure that this person's experience is heard and that they convey a sense of empathy and understanding for what this person has experienced.